I'd like to share with you some of the perspectives that I have as a physician and things that need to be rectified in terms of the quality of care that people provide. For example, I have had a person had AIDS, a young fellow, who I was called about on a Friday afternoon because of the identification in his blood of a type of tuberculosis. I called in a prescription for him and thought that it would be provided. But instead, I was told by the pharmacist that there's no payment for that, we can't provide it. I said, well, who's your insurance? He said, Medicare. Called, and actually it's Medicare disability. I called them and the number that he had and went through a whole rigmarole about trying to find a way to provide these medications for him through the pharmacy. Eventually I got to the point where they said, well, you know, we really contract out for that. And I said, well, who do you contract out for medication so I can get this fellow what he needs for his bacteremia? And they said, well, we contract out with AARP. I said, great. I mean, I can't imagine that there isn't somebody there to take care of the problem. Again, I went through the rigmarole and found out that, well, AARP contracts out with a pharmacy. It's a nationwide pharmacy. So I called them after spending an hour on the phone and was told by the answering service that they didn't have the authority to change things or to provide the medication. And I said, can I talk with the doctor who's on call for your nationwide organization? And he said, well, they closed 2 hours ago in California. This is a Friday afternoon, and there's no doctor available. And I said, well, how about a pharmacist or someone that can authorize medication? And they said, well, we just don't have anybody on call. You can call on Monday. This is Friday afternoon. I said, you know, that really isn't appropriate. Is there someone I can talk with as far as a supervisor or someone so I can find this man his medications? And they said, well, I do have a supervisor on call, but it often takes 24 hours for her to call back, and I haven't heard from her since. I was able to convince the local pharmacist to provide these medications at no charge, but this is the backup that I receive as a physician, and I've checked it since then as well. They take people off responsibility. They're not available, whether it's through AARP or pharmacies, because they save money that way. It's a form and a subtle one of denial of access, cost savings. And if it reaches the physician's level, that you don't see it outside. You see it on the inside. It's estimated that every practice spends on the order of $70,000 a year in support to get through the barriers, the limitations, the problems, the restrictions, the duplication of efforts that are needed to try to save money for the insurance companies. So don't forget about the physician who's trying to help you is blamed for the problem that the medication doesn't come, but rather the system that's been created. And I hope you're able to help with that as well.